So in this video, I'm going to be teaching you a new breathing technique. In yogic terms, it's called Nadi Shodhan, also known as alternate nostril breath. And as the name would suggest, this breathing technique involves breathing alternately between our two nostrils. There's actually many different variations of this technique. I'm going to be teaching you the most traditional, the most standard variation. And as you've learned so far in this course, our breath in general and the way we use our breath in particular has a very direct effect on both our mind and our body. So depending on how we're breathing, there is an effect that's having as a result of that breath. And so this particular breathing technique is meant to bring balance to your mind, balance to your nervous system. Breathing through the nostrils alternately, there's a connection between each nostril and that hemisphere of the brain. And as we know, the brain is responsible, each hemisphere is responsible for different cognitive abilities, different physiological functions. So this just harmonizes all of that. This breathing technique is meant to bring harmony and balance and equanimity to both your body, your nervous system, and your mind. And it can be used very safely at any time, but it's particularly nice and particularly effective if it's done before you meditate. It just helps bring the body and the mind into a state of balance and calm, and opens you up to be really receptive to a deeper, more productive meditation session. So I definitely recommend doing this anytime you can before you meditate. Okay, so to do the breathing technique itself, we use our right hand, and traditionally we use the thumb and the ring finger to block off the nostrils alternately. Now, for some of you who are not used to, holding your hand in this position, this might feel a little awkward. So if that doesn't work for you, you can also use your thumb and your pointer finger to block off, or your pinky. And any of those options would be totally fine. But if you can, try to use the ring finger. That's how it's traditionally done. And basically what we're going to be doing is we're going to be breathing in and out through one nostril with the other one blocked, and then we'll switch and breathe out and in through that nostril while the other one is blocked. Okay, so a couple of things to keep in mind. You want to make sure that when you block the nostril that we're closing, it's completely blocked. You don't want any air to be able to pass in and out of that nostril. And when you're changing sides, when there's the crossover between sides, you want to make sure that you have a moment when you're closing both nostrils before you open the other, so that you are not having a moment where both nostrils are open before you close. Okay, so how this is traditionally done is you take an inhale through the nose, so that the mouth is closed. Inhale through the nose, through both nostrils, then we close the right and we exhale through the left. Same side, we inhale through the left, then whichever finger you're using, you close the left nostril, so both are closed for a moment. You open the right, and then you exhale through the right. Now you inhale through the same side, inhaling through the right, close the right, open the left, and exhale through the left. And you continue like that. So inhale, close the left nostril, open the right, and exhale through the right. Inhale through the right, close, and open, and exhale through the left. And we just go back and forth like this for several rounds. Generally, it's good to do at least 2 to 3 minutes. If you can do it longer, that's even better. So what you want to remember is we inhale through both nostrils, so we begin this by exhaling through the left, and in order to complete a full round, we end by exhaling on the left. So we're always beginning and ending with an exhale on the left side. Okay, so There's an audio practice of this, so I'll walk you through it during the practice. A couple things just to keep in mind about this technique. Again, it's meant to bring balance. So we want the breath, the inhales and the exhales through each side to have a sense of balance. So if you're counting maybe a 4 or 5 count breath in and the same amount of breath out. So try to have the inhales and the exhales even in length. This breath should also be very soft. There should be nothing hard or aggressive about this breath. So try to bring a sense of softness to the inhales and softness to the exhales. Okay, so again, just to recap, and I'll go over it with you again in the audio, so if it feels a little confusing, don't worry about it. You'll get the hang of it quite easily. Just to recap, with the mouth closed, we inhale through both nostrils, then we close the right and we exhale through the left nostril. Then we inhale through the left, close the left nostril, open the right, and exhale through the right. Same side, you'll inhale through the right, close the right nostril, open the left, and exhale through the left. Again, inhale through the left, close the left, now open the right, and exhale through the right. And now you'll inhale through the right, close the right, open the left, and exhale through the left. And once you've exhaled through the left, then you can release the hand and finish. So however many rounds you're doing, make sure you finish the round by exhaling through the left. Okay, so now I'll walk you through an audio practice of it and enjoy. And don't forget, you can do this at any time, but it's particularly nice before your meditation practices.